All right, well, thank you very much. And it's interesting, I think, as we talk here, the cancer and exercise world started on the right and is moving left, so it's the exact opposite of what you're talking about. So today I'm going to give you sort of an overview of sort of the updates in rehabilitation and exercise prescription research in cancer survivors, highlighting some of the things that are happening here at the University of British Columbia especially, because certainly UBC and cancer in Canada in general has really been a leader in this kind of research. So I'll try and highlight that. So why is it a field in motion, other than a terrible analogy, I think, to physical activity? The reason I said that is that there's been a dynamic change in the last 10 to 15 years in what we know about exercise for cancer survivors. And one of the main reasons I think that is just a plethora of research that's happened in the last 10 to 15 years. So this is just a nice graph, which my grad student helped me finish off for the last 2 years, looking at the number of publications that look at exercise and for cancer survivors. And you can see from the year 2000, there's been a real increase in the amount of research. So it's given us a lot more information of what we know about how exercise can be used for cancer survivors in rehabilitation and also in healthy survivorship. So that's helped a lot. Also, there's been a real interest from survivors, and I'm sure everyone here can identify Lance Armstrong here. There's been a real interest from survivors to know more about supportive care for cancer. So what else can I do during my cancer treatment to improve my quality of life? What things can I access that will help me move through this journey? And so the Livestrong Foundation has been sort of at the forefront of that information, especially in the US and also around the world, of really providing information for survivors about accessing services that will improve their quality of life and cancer journey. And physical activity has been a big part of this. I mean, obviously it's related to Lance Armstrong's fame in the first place, but certainly physical activity has played a huge part. And survivors are really wanting that information. That's what's driven a lot of the research that we've done. And also, there's been a real shift in clinical focus. So, not that long ago, the recommendation was to rest, reduce activity during your cancer treatments. There was a potential for lymphedema that was linked to lifting anything over 10 kilograms, any vigorous upper extremity activity. So that impacted people's they had fear around doing activity in the first place, as well as it may have limited not only exercise, but a lot of their daily physical activity, daily activity as well. There also are some contraindications and precautions that were related to exercise specific to cancer populations. There was a feeling about anemia and neutropenia, which are side effects of cancer treatment, and how that might be contraindicated for cancer and exercise. On the flip side of that, I think there was an increasing interest that sort of went along with the research to show the possible benefits of exercise in this population. And the research has sort of been able to counteract some of these previous notions about why exercise might be contraindicated. And there also was a shift towards a focus in survivorship. So as cancer treatments have improved, the survival rate in numerous cancers has also improved with that. And so with that, there's a real focus beyond, I've finished my cancer treatment, but now my quality of life is important beyond that. So there was a move in the clinical community as well as in survivors themselves to say, I finished my treatment, but now I want more from you, my oncologist, or you, my physical therapist. So this is just a nice schematic that I think sort of overlays how exercise could be integrated along the cancer journey. And it was developed by one of the sort of leaders in the field of exercise and cancer, Dr. Carrie Kernier at the University of Alberta. And what it sort of shows in blue is what exercise could be doing. And along the bottom in white is sort of the timing along the cancer trajectory. So certainly exercise has been shown to potentially help with prevention, so lowering the risk of certain cancer types, and that's been well demonstrated. I'm not going to talk about that today. There was also a thought that physical activity might help with cancer detection, so something about activity or being assessed for activity may actually allow detection of cancer earlier. There's been very limited research in this area. In fact, I think that might be none, so it's theoretical. Also, too, in the pre-treatment time, so after a cancer diagnosis, could physical activity help with what they call buffering? A good example might be lung cancer. So after a lung cancer diagnosis, would 4 weeks of aerobic activity during the time frame from diagnosis to surgery help to have a better outcome from the surgery following the surgery. So improving physical function, which is an outcome measure for morbidity in lung cancer surgery. There's been a little research there. There also was a thought that physical activity could help with coping during treatment. So will activity help improve some of the side effects of treatment, things like fatigue, nausea, decreased physical function? Physical activity may help with that. Also, rehabilitation. So after cancer treatment, which we normally think of as surgery, chemotherapy, and radiation, does physical activity play a role in rehabilitation? So return to full function, whether it's shoulder range of motion, physical function in terms of aerobic capacity, those sorts of things, as well as moving beyond that to a health promotion model. Can we add activity just in cancer survivors in general to improve their overall health, decrease their risk of other chronic diseases related to being less active, things along those frameworks? And would that impact their survival? And I'll talk a little bit about that. Also, they suggest that exercise may be important for palliation as well, when curative therapy is not the main intent, but there's been less research in that area. So this is my attempt to show the evolution of the research focus, and this might show the left to right shift. The first studies really focused on safety. Can cancer survivors participate in activity? Is it safe for them to do that? A lot of the research was led by oncology nurses in the sort of 80s, and that's where the research really started. From there, in the 90s, it really focused more on improvements in psychosocial outcomes. So a lot of the research in exercise in cancer survivors was led by exercise psychologists. The main outcomes were quality of life, self-actualization, happiness, all of these things that are more the psychosocial outcomes, which is very different from the musculoskeletal area. And once the safety was shown and it showed quality of life, then we've sort of moved now in the late 90s to in the 2000s to really sort of look at these physiological outcomes. So whether it is improvements in aerobic capacity, immune markers, muscular strength, all these sort of things. So the exact opposite from musculoskeletal. And the forefront now is looking at survivorship. So does exercise following your cancer treatment and diagnosis improve your survival or decrease your risk of recurrence? There's a new trial that's just started. It's multi-center in Canada and Australia. It's enrolling individuals after they've finished their colon cancer treatment. They're randomized to 3 years of aerobic activity or usual lifestyle. And the endpoints they're using are recurrence and outcome at 3 years. So it's going to be a long time until we get that information, but that's the newest area of research, is looking at how exercise might improve survival. So I just thought I'd pick out a few specific areas of research that have been done in cancer and exercise to try and highlight for the group. The first is shoulder outcomes following breast cancer. And I'm going to apologize for the lack of outcome measures we're going to talk about here after the last talk. This is a Cochrane review I did with my colleague at the University of Alberta, Margie McNeely. And the title is there. And we looked at upper limb dysfunction related to breast cancer treatment. I'm just going to highlight a few of the specific questions we looked at. One of the first was early versus later post-operative rehab. So once you had your breast cancer surgery, were you starting range of motion within the first 3 days? Or were you delaying that range of motion for 4 to 7 days? The reason we looked at this is there's a lot of discrepancy in the literature about when to start this type of activity. And so we wanted to see what the literature said. There were 10 studies. And I've summarized there some of the different recommendations that were given. Some had range of motion to a point of pain. Others were unrestricted. Some had very prescriptive on day 1, try and get to 90 degrees of flexion. Day 2, get to 180. So there's a variety of approaches. But overall, what we found is that the shoulder range of motion improved most with the early range of motion. So the range of motion that started right after post-operative. But there were some issues around wound drainage and the duration in which some drains had to be in surgically. And so there's some issues around that potentially for infection and seroma formation, and potentially leading to an increased risk of lymphedema, although that's very speculative at this point. So that just sort of highlights what the literature is saying. It's pointing towards the earlier, but there are some of these issues, and so more research really needs to be done on that. We also looked at structured exercise in the form of sort of a post-operative or preoperative handout, so to go through these general exercises. versus a PT program that sort of followed people over time, over the early post-operative time. There were 6 studies on this, and I'm happy to tell you that both groups did improve their shoulder range of motion, but the group that did the physical therapy program that had interactions with the therapist had a better improvement in shoulder function. The big thing, too, we also noted with all of the studies we looked at from post-operative, right after operation, or all the way through to in survivorship, there was no increase in lymphedema with any of the upper extremity activities that they looked at or were prescribed, which is a really nice outcome because that's a big fear for breast cancer survivors. Just to follow up on this too, there is a study that's trying to extend some of this information. It's being done at Surrey Memorial Hospital, and the title is there, and the PI is Kiara Singh. And she actually got an award from the PAVC Research Award for Physiotherapy Projects in BC from the Physiotherapy Foundation of Canada to look at this question. She's looking at early physio intervention and standard pre-op education versus the education alone, which is being done at another site in the Lower Mainland, which we won't name. And so she's looking at the comparison. It's the Surrey Memorial versus this other group that only does the pre-op to look at arm morbidity and quality of life at 7 months post-op, to try and institute some more follow-up and see whether that's helpful. The program is pre-op teaching, a follow-up at 1 month, and a follow-up at 6 months. And that just is to look at some of these outcomes and see whether there's any problems and to get people to the right services at that time. So a little bit more proactive follow-up. And we'll see what happens with that. Moving on to acute care, I have to tell you there's not as much research on exercise in inpatient populations with cancer. Some of the highlights here are lung cancer. There have been some studies pre and post-op in inpatients to see whether exercise or more of a cardiorespiratory physio approach can help in the outcomes in this group. Stem cell transplantation is another group that's been looked at for acute care. Certainly these individuals, potentially through their course of treatment, are immunocompromised and sort of confined to a room. So wheeling in an exercise bike is a great way for them to be active, and they honestly probably don't have too much to do, unfortunately. So they probably watched every TV show 10 times. So this is an area where we can actually intervene potentially. It's a bit of a captured audience, unfortunately, for them. Also in hematological malignancies, lymphoma and leukemia, there's been some inpatient work there. I'm not going to go into too much detail, but if someone has questions, they can certainly ask. But a lot less research, and this is probably the area where most physios potentially would see these individuals in an acute care setting. In my experience working at the cancer agency, and it's really a lot more like usual inpatient care in terms of mobility and a lot of those issues versus improving aerobic fitness.